This
is Journal
club.
Oh my god, these wings, they look so good. I can't eat them because I'm too fat. Well, whatever should I do? Oh wait, I can just take Ozempic and be skinny. Oh, there, now I'm skinny and I can eat these wings.
Wow, where's Kevin when you need him to start the combo?
I was gonna talk about, have you heard?
Here, wait, come down closer. Dad, have you heard of Ozempic before?
What's that?
Have you heard of Ozempic before?
Ozempic? Yeah.
What do you
Ozempic or
think?
Ozempic?
Ozempic.
No. What's that?
Yeah, wait, what is Ozempic?
So Ozempic is semaglutide, and it's an injection usually taken in the thigh or the lower abdomen to treat diabetes or obesity.
Oh, wow. So they originally developed it as like a drug to treat diabetes.
Yeah,
Yes.
but then people started, especially celebrities started using it after they realized they could help with weight loss.
I feel like I always scroll on Reels and I see these influencers and models and they're like, look at me before and after Ozempic. I'm like,
It's pretty crazy to see these transformations. Some of them are kind of insane.
yeah, it is crazy.
People can usually tell when you're taking Ozempic or something, because you lost all this weight in such a short amount of time.
Mm-hmm.
Yeah.
But how does it really work? Anyway, so that's the question. So semaglutide acts as this is a mouthful, glucagon-like peptide-1 receptor agonist by enhancing insulin secretion and suppressing glucagon release. So I'm sure you guys have heard of insulin. It's related to both types of diabetes. When you don't produce enough of it, maybe because you've had hyperglycemia so much or for so long, when you have so much glucose in the bloodstream, your pancreas is supposed to release insulin to move the glucose to your cells. But if you have so much glucose in your bloodstream that you run out, you just use insulin over and over and over again, and then it stops producing it, insulin resistant. And that causes a lot of problems. So this is another way to approach it. Rather than taking insulin shots, which is another treatment for diabetes mellitus type 2, you can also take semaglutide, which addresses a different angle of it, glucagon. So glucagon is also released by the pancreas, and its responsibility is to tell your body to turn glycogen, which is like glucose storage in the muscles and liver, into glucose, so going backwards in the process. And so by suppressing that, you reduce hyperglycemia because you won't have glucose to go in the bloodstream at all because it stays as glycogen.
Is there an advantage to using this semaglutide versus insulin, or for certain types of patients that would use this versus an insulin shot?
I think that's a really good question. I would think this is better because it kind of avoids what insulin's trying to fix in the first place, rather than just addressing we have glucose in the blood. It's kind of we don't have glucose in the blood in the first place.
Okay.
So it's more of a root cause kind of.
Yeah.
Okay, versus a temporary solution.
Yeah, so
Okay.
I guess we can just think of anyways.
But that's why it's so good, is because obviously you will have glucose in the bloodstream when you eat a meal like a normal person, but it's not as much, and it's not when you're going about your day and then your body's okay, release glucagon, we need more energy for our cells kind of thing.
So not in excess.
Yeah.
And doing that, you usually turn to fat to break down, and that's how you can lose weight really quickly. Just one of the ways, but yeah.
It suppresses your appetite as well, right? So you don't eat as much.
Oh, so all of these amazing side effects, I guess, of Ozempic are just side effects. Being able to lose weight is not their primary cause, but
Yes.
it is one of the big properties of it, right?
I mean, to my knowledge, it was originally created for diabetes.
Yeah.
And then during testing, they realized that it's such a valuable tool for treating obesity. So they tried to address that as well. And then people with money kind of
Got their hands
abuse
on
that.
it. Yeah. Well, there's got to be some negative effects to just using Ozempic purely for weight loss, considering that most of these people don't have extreme circumstances or they don't suffer from diabetes.
Well, that is the question, huh? So this study, called Assessment of Thyroid Carcinogenic Risk and Safety Profile of GLP-1 RA Semaglutide Ozempic Therapy for Diabetes Mellitus and Obesity, a Systematic Literature Review, is a review that analyzed about 10 randomized trials from other people's studies, which turned into about 14,550 participants. And they just looked at those people's side effects without conducting their own study, but they used that database and tried to find what side effects there really are to semaglutide.
Biggest thing was thyroid issues, right?
Yes. So when they conducted studies in animals before Ozempic was like released to the public, or in human studies, they found there was an increased risk for thyroid C-cell tumors, but they didn't find any of this in humans, probably because it wasn't in a long enough period to see that.
That's true.
So,
It's pretty recent, like the use of Ozempic, especially used for weight loss.
Yeah, I mean, I've only just heard of it within like the past year or so.
Yeah.
So, not enough time, I guess, to gather data and run these studies to find out, what are the more negative side effects of like overusing or abusing Ozempic when you're not supposed to.
Yeah. Well, let's dive right in. So the key finding, I'm just going to list them and then we can go back and talk about it. So they found a great increase in gastrointestinal symptoms, which is like diarrhea, vomiting, and constipation. And they also found nasopharyngitis, increased prevalence. There was increased lipase levels, which is an enzyme to help break down fat, which makes sense. I mean, if you're not converting glycogen into glucose, you have to go to fat to turn it into energy. Headaches and flu-like symptoms as well. And it was kind of interesting because even though they set out to prove that it could increase the likelihood of thyroid cancer, they didn't find any of that. But that's because all of these studies that they referred to, these 10 randomized control samples, were only done in like a year. So if they went back maybe in 10, 15 years, I'm sure they would find something. But yeah.
So did they have any like possible explanations for why Ozempic saw these increases in like gastrointestinal symptoms or nasopharyngitis? What is nasopharyngitis anyways?
Right.
Inflammation in your nose and throat, basically. It's
Yeah.
basically the common cold.
Yeah.
But yeah, why does it cause
Yeah,
these
so, like,
symptoms?
So first, the gastrointestinal symptoms makes a lot of sense because, I mean, you're adjusting, probably your diet is going along with this, but even if you keep eating maybe a poor diet, or you were eating a healthy diet beforehand, it's still a shock because you're not going to be eating as much. And also, especially if you are an obese patient or a patient with diabetes or both, I'm sure with Ozempic you are given a diet regimen to help, I guess, like kind of balance it out and make sure you get enough nutrients. And that is a big shock on your body. So I would say, I don't know if it's really, it's probably causation and correlation, but gastrointestinal symptoms is just, I think, commonplace.
Especially because it's just so fast, right? Like your diet's just being constricted, and then you have slower digestion, there's extra pressure on your stomach.
Yeah.
So that could be a big reason as to why your body's kind of like reacting this way.
Yeah, makes a lot of sense.
Yeah, so probably in the long term, these symptoms go away. Constipation is probably increased. Like fiber intake, just drink more water, get adjusted. Diarrhea may also be related to that. But with flu symptoms,
Respiratory issues.
It's very interesting, yeah.
I would say that's kind of a surprise. What I think it is probably related to just stress on your body. I mean,
Yeah, that would make sense.
when you're losing weight and I guess probably adjusting your lifestyle a lot, then it makes your body more vulnerable to
Yeah.
catching infection.
Big upsets in homeostasis for a little bit.
Yeah.
Is it something
Or
you
a
have
long
to take like constantly, or can you just stop once you've lost like the weight that you want?
Pretty
So
sure it's lifelong maintenance, or not necessarily like you're on Ozempic for forever, but with anything, like if you were previously obese and then you lost a bunch of weight, you still have to maintain
okay.
that. So I think it is like,
yeah, I think it depends on why you're taking Ozempic. If you are of a healthy weight and you want to be even skinnier, then you probably want to maintain that if that's what your goal is. And that could either be done by adjusting, just eating less and exercising, reasonably, but probably more than you were before. And you could probably wean off of it. But, if you haven't, it's kind of a homeostasis thing. Like when you lose weight, people bounce back because like their set weight hasn't adjusted yet. So if you are an obese patient or a diabetic patient, I would imagine you'd have to take it for a long time. It takes a long time to, especially for obesity, to maintain a healthy weight. But
yeah.
I think it's still like incredible.
Yeah.
Yeah.
Then there's like the social and economic effect of like Ozempic becoming more prevalent, right? Because now that celebrities have been taking it, people like the common people have been like seeing like just the transformations that have been like occurring. People want to get their hands on this
Yeah.
because it means like more demand, which means prices go up, and also means that people who want or actually need to take Ozempic aren't necessarily able to get their hands on it, either just because of demand or because it's too expensive.
Right. It's a big economics.
Yeah.
Big economics question at that point, right? The supply is not so much and the demand is very large. And maybe the people who need it most can't necessarily afford it, while other people who are abusing it or not, using it for things outside
Using it
its
recreationally.
yeah, outside of its intended purpose.
Yeah.
Like insulin, for example, is like getting more and more expensive, and a lot of diabetes patients are already suffering with like being able to afford that. And imagine people who need like Ozempic turning into the same sort of case, except people don't take insulin recreationally.
That would be
Heard of
weird.
this new drug insulin? Yeah, I really want to shoot up.
Yeah, because semaglutide is synthesized, there was a shortage at one point, I think, partly because celebrities started getting their hands on it, and I mean, obviously the people who create it want to make money and keep it going, but yeah, the supply did not match the demand. And I think now, I know there's it's very in the news right now. There's some lawsuits. I haven't really dug into why they're happening, but I would imagine it's probably similar to the supply and demand issue. That or the side effects, but yeah. In the future, I'm sure it will be more mass produced, but it's not adjusting fast enough.
Yeah, I guess only time will tell what other side effects will be revealed with this misuse or just general use in general.
Yeah.
We'll
And
see.
Ozempic is only one. I mean, there's so many different versions of this. Another synthesized, what is it, like a protein or whatever, peptide that can act similarly or lead to the same result. And I don't know, we'll see.
We'll keep you updated.
But
Thank you for watching.
No.
Let's all signing off. Wait, no, we have to go in order.
What's the order?
Kevin Chen signing off.